me and tells me what to do and what to take and stuff. So he recommended that I take these pills, and I wrote it down to show you.
Mm-hmm.
Can't find them. Where is that thing?
I remember the one is the Linzess.
Mm-hmm.
The Linzess.
Yeah,
Yeah, I see that in
that's
here.
the big gold.
That's the one.
Yeah, that's one of them.
So does that help you?
Oh yeah, I
Yeah.
have trouble with my bowels.
Mm.
So before I go to bed, I take a, I can't remember that. I think it's polyurethane, but I'm not
No.
sure. And a couple other pills, and I go to sleep. And the next morning, I get up. Oh, here it is. I take promethazine before I go to sleep. 1 promethazine and 2 melatonin. And I have here magnesium bone strength. So I take one of those. I don't know why I take that. And then I go to sleep. I take these, I go to sleep, and I wake up at 5 or 6, and I take 1 Len-Z, because Len-Z is very strong laxative,
Mm-hmm.
and I call it the silver bullet.
Yeah.
So I get my silver bullet at
Mhm.
11 or 1 o'clock or 1 o'clock in the morning, and I have my breakfast and my bowels move. So I got that pretty well, I think, under control. Once in a while,
That's good.
it works out. Doesn't always work, but it's usually pretty good. And that's so good because you hate to have bowel trouble.
Yeah.
Ugh, I mean, I have a lot of friends. Oh, I can't. Oh.
I had a patient one time tell me she hadn't gone in like 14 days. I was like, how are you still walking
Oh,
around?
gosh.
And like, how are you not like in severe pain and grimacing? How'd you make it in here?
Well, Dr. Sun told me he had a lady, she lasted,
Two weeks or
2 weeks.
Yeah, that's what I said.
Same
14
thing.
days. Yeah.
Weeks, oh,
And
so
then,
you've
like,
been very regular with this regiment.
yeah.
You've been, I mean, yeah, very
Well,
regular.
he's helped me and he's
Yeah.
got me on, yeah.
Huh.
I'm good with that.
Yeah. Okay. So it seems like, whatever he recommends, you're willing to do, huh?
Yeah,
Yes.
Yeah? Why is that?
Because he's really nice. I like him.
Okay.
And I think he knows what he's talking about.
Oh.
It's a ugly thing to
Yeah, not be able to
have to
poop.
look into.
Yeah, for sure.
But
That's for sure.
He has a sense of humor and it's funny.
So the one medication, because if you remember just a couple minutes ago, we were talking about how you have low bone density, which is called osteoporosis.
I have that?
Mm-hmm.
Oh, I didn't know that.
I have it too, just so you know.
Yeah, and so that increases your risk of having a hip fracture or just a major fracture. And there's a medication that I think we had a discussion about last December, and I thought we had decided to start it, called Fosamax. And it helps rebuild your bone or make it stronger. And it's a medication you take once a week to do that.
I don't remember that, do you?
Yeah, I remember him recommending it, and
We didn't do anything of that.
I don't think you wanted to take it.
No, I didn't mind that, but I don't remember taking it.
Okay, all right.
And so now sometimes the most common side effect, doesn't mean you're gonna get it, is almost kind of like this acid reflux or burning in your chest. And ways to get around that is to take it with a big glass of water and stay upright for at least an hour after taking it. But, my concern that we were talking about earlier was if we don't rebuild your bones, it's going to be really easy for you to fall and break something, and I don't want that to happen, right? So that would be kind of not the alternative.
Do you have to take it in the evening or?
No, you can take it in the morning. You can take it first thing in the morning when you wake up, and it's once a week. Yeah.
I guess I could.
Well, I have a chart for her
Yeah.
of what to take each day that she checks off.
Gotcha.
And we could add it to the chart that, like, say every Monday when can you eat food around it or?
Yeah.
Yeah, so you could take it in the morning. He's just saying you can't lay down for an hour after taking the pill. You have to be up for the day.
I thought he said you do lay down.
No.
No, you have to be
Because
up. You
Because
have
when
to
is
be.
acid reflux worse? It's when you lay down flat because it's a lot easier for acid
Yeah.
to leave
yeah.
your stomach and
Yeah,
cause
I
those
understand
symptoms.
that.
Yeah.
Yeah.
So.
But normally when she gets up in the morning, she's up.
Yeah.
Gotcha.
She doesn't nap in the morning ever.
No.
So if you took it every Monday morning,
Yeah.
he's saying it could help build the bone back that,
That
Yeah,
you
maybe
lost
that's-
after
I
menopause.
should take that, I guess.
hmm?
I should take that.
Yeah, probably.
Yeah.
Yeah. Because what he's ultimately saying is if you were to fall, your chances of a fracture and a break is much higher.
Yeah.
And this could help.
So, if I send that to the CVS on Madison, you feel like that's something that you can get on your plan for every Monday or whatever day you choose to do
Yeah.
it once a week?
Oh, I don't have to go up and buy one once a week.
No,
You just buy the
you'll get 12 of them at one time, so it's 3 months worth.
Okay.
And then there'll be 3 refills in there. And once you start it, we like to continue it for at least 2 years because it kind of takes that long to really help build that bone back up. And then we recheck the bone scan in 2 years to see if it's done what we hoped it would do.
I don't know if I should do, I may not be here in 2 years. So you're wasting all the time and getting it and trying and laying down and.
Not laying down.
Not
Not
laying
laying down. Not laying
down.
Yeah.
I
But if it
mean,
could strengthen your bones in the meantime,
Yeah,
is what
I
he's
don't
saying.
know. Maybe it doesn't work until you take it for a year or two. The way he sounds, I'm not sure.
Does it take very long?
No, it doesn't take the full 2 years for it to work. It just, that's how long they recommend waiting in between scans while you are taking it. Now, you will start to notice it start to work. Now, granted, you're not going to feel anything different per se. It's not like all of a sudden you're going to feel like Superwoman. No. But it does start to work in your bones right away, and the more doses you have, it builds on itself and it continues to build that bone. So then in 2 years we recheck and see. Now, yes, you're not wrong. Not every medication works for everyone. We're all different genetically and how meds work for us and whatnot. So it could not, but majority of the time in patients that I started on, I would say 90%, they see improvement in their bone density and strength over the 2 years of taking it. So
Well, so you take it and lay flat for a while?
no flat.
Oh, what was
Acid reflux. Do you want to lay flat with acid reflux?
that? Yeah. Oh, yeah.
No.
Okay.
You stay upright.
Yeah.
So that's why she was saying when you get up in the morning, you're pretty much up for the whole day.
Yeah, right.
So that would be the best time for you to take it because you're going to stay upright and
Yeah.
be a lot
okay.
less likely you having side effects.
Okay, well,
Yeah.
I guess I can take that.
Gotcha. Okay. And then with that, you said you're taking magnesium, right?
I think so. You said at nighttime you're taking magnesium. It was on your green list there, I think. At bedtime?
No, I don't take anything at bedtime.
Oh, it doesn't say magnesium on your list?
Mm-mm. These are the things I take in the morning. One promethazine and melatonin, 2, and magnesium.
Magnesium.
For my bone. And then Lindsay early in the AM. That's all I take.
So I would hope you're not taking melatonin in the morning.
No.
Because that would make you sleep.
No, it's at night.
No, that's at night.
Okay.
I take 3 pills at night. Two melatonin and 1 promethazine.
Yes.
Yeah.
But it says magnesium. You listed magnesium.
I did. Magnesium.
That's what he's saying. You're taking the Is that the chewable one or you swallow that?
I don't know what about that magnesium. It's in a jar and
It doesn't really help with bone health.
you gave it to me.
But it can sometimes.
Chew it
I can't
Sometimes
remember.
it can help with digestion
for the bone.
and constipation sometimes. So maybe that's why you're on it, because sometimes it can help with constipation.
What?
The magnesium sometimes can help with the constipation.
Oh,
So maybe that's why you're on it. Also sometimes can help with like muscle aches.
well, I have here bone strength, magnesium, and you got it for me, and it comes in a chewy thing.
Oh, I thought I gave you a multivitamin that was
Well,
the chewy.
that's what it is.
Yeah.
So, okay. Well, let's start this cylindrinate and we'll see how that goes. And then do for a little bit of blood work today. Is that okay with you?
Yeah, sure.
Yeah. Well, let me take a look at